finally enough about Mary, and take it away, Mary.
Thank you. The feeling is mutual. I'm very lucky to have Diana as well, and boy, you're going to make me blush. Thank you all for being here. There's such a nice turnout here, and thanks to Joanne for connecting Rose and me. I really appreciate that. Thank you. Okay, so tonight we're going to talk about the maturing phase. Okay, so just a little bit more about me. Diana mentioned, gave me such a nice intro, but just to tell you a little bit more about myself. So I graduated from University of Maryland with a bachelor's in finance, and I worked on Wall Street for a few years. I was at Lehman Brothers. We all know how that turned out. I just, I wasn't really feeling fulfilled, and when the company went bankrupt, I was like, oh, I gotta dig deep and do some soul searching and figure out what it is I really want to do. I have this like new chance to kind of do my, my calling. So I had sort of always regretted not going to med school. At that point in time, I didn't really want to do that and totally start over. One of my friends said, what about becoming a PA? And I was like, a personal assistant? She said, no, a physician assistant. I didn't even know what a physician assistant was. This was 2008. So started volunteering in the emergency room at Beth Israel. I was in the city at the time, and I was like, yeah, I like this. I think this is what I want to do. So I did PA school at Cornell. While I was there, I did a rotation in dermatology. I loved it. I, ever since graduation, have worked in dermatology, medical and aesthetic derm. And it's just been very rewarding, very fulfilling. I love that, I can work with various demographics, and I love the visual aspect and the hands-on aspect of it. So I feel like I'm now, where I'm meant to be. So, about 2.5 years ago, I opened a med spa in New Canaan called Element Medical Aesthetics. Prior to that, I was at Dr. Banks in Mount Kisco, Schweiger Dermatology, and I served as an investigator on some clinical trials for Allergan, MERS, and Galderma, and I was a former medical speaker for Pfizer. So now I'm an entrepreneur and I'm loving it. So thanks again for having me. Okay, so this is something I say a lot throughout the day to people. Aging is better than the alternative, right? So, I don't know how the word aging got this negative connotation. I remember reading an article in Allure magazine in 2017, and they phased out the word anti-aging. They said, well, anti usually comes before something negative, like antiviral or antibacterial. Anti-aging, why is aging a bad word, right? Like, we should all be so lucky to age because the alternative is not great. So, I think with that said, we all kind of choose our own path, how we want to age. And I think in terms of our appearance, for some people, feeling our best, looking our best helps us feel our best, right? They're correlated. And everyone draws the line at different points. Some people, they'll dye their hair, but maybe they don't want to do Botox, or someone else does Botox, but they don't wear makeup, or someone else is okay with plastic surgery. So we all have these different thresholds and cutoffs of what we're okay with. And my job isn't to judge that. It's if you want to do something, if it's internally motivated, you're not feeling outside pressure from your husband, from society, but you want to do something that can help you feel better, I'm here to help you do that. And so I'm just going to talk a little bit about some of the things that happen with the maturing phase. Another thing I say a lot, I'd rather look old than weird. There's a lot of weird out there. We don't do weird at Element. So
no weird.
Yeah. So all my patients, they're really looking for a natural aesthetic. I'm sure you've all seen those people where they walk in the room and their lips enter before they do. If that person comes in to see me and they want me to make them bigger, I say no. I explain why, and it's their decision if they want to stick with me or if they want to go get the big lips somewhere else. But that's it's just not.
You actually do a lot of corrective.
Yeah, I do.
A lot of corrective.
Yeah, like dissolving things. So
of other people's mistakes.
Sorry. Jocelyn Wildenstein to make my presentation, but this is what I mean about I'd rather look old than weird. So why does something like this happen? There's this concept called perception drift, and that occurs when individuals constantly undergo procedures, they don't remember what they looked like initially and before the cosmetic changes, and they keep doing it. They kind of get this new normal, and then they keep going. And another reason that this happens is social media, filters, and then greed and lack of artistic acumen on the part of the provider. So these are all things that can contribute to this like looking weird that people are afraid of in the industry. When I tell people what I do for a living, that I inject Botox and I filler and lasers and all this stuff, like the men typically, they're like, ooh, no, my wife can't come to you. And it's like, well, you know what bad filler looks like, but there's a lot of good filler walking around, you just don't know it because it's good, right? So I think people...
and your wife is coming to me.
And your wife is coming to me, yes. With that said, it takes a lot of treatments to kind of make someone look weird, and that's where, we'll talk a little bit more about that. But here's where we're gonna get into what happens to the face. So when we're younger, we have what we call the inverted triangle of youth. We have this, like more volume at the top. Temples are fuller, high cheekbones, lifted cheeks, defined jawline. As we age, we start to go into a triangle where we're heavier at the bottom, some jowling, flattened cheeks, and so, if we can kind of work to restore things back up, that is helpful. Contributors to the maturing face. So I used to call this the evil triad because I had 3 that I would mention: collagen loss, bone resorption, and fat atrophy. But I've added a couple of things to the list. Pigmentation changes and changes to our musculature are also things that contribute to this. And you can see this is one of the photos is mother-daughter. This one I think is like an AI generated thing to show the aging over time.
Excuse me, before you go, the last screen, what is the last one? Changes to
Musculature.
how does
Yes.
that happen?
Well, I'm going to go into all of these in detail, and
Later?
and then we will also have a Q&A where you can ask me whatever you'd like. But yes, good question. Stay tuned. Okay, so collagen as we age. Collagen is a structural protein that's found in our hair, our nails, our skin, and it helps maintain elasticity and support. It also holds moisture, hydration, and natural collagen is formed in the layer of our skin called the dermis, and the type of cell that produces collagen is called a fibroblast. Collagen decreases about 1% per year after age 25, and women lose collagen at a faster rate after menopause. So on the left, we have a youthful epidermis. You can see it's flat, it's smooth. And then on the right, we have more aged skin, where you can see the lines, the folds, and the wrinkles have become etched in. And this is where the musculature comes into play. We make facial expressions that over time etch those wrinkles in. Now, when we're kids, when we're babies, when we're teens, whatever, we make facial expressions, but the lines don't stay etched in because our skin has more support and elasticity and it bounces back. But as we age, these things start to, get etched in a little bit more. So this is one of the things that happens, and it's not just muscle movements. It's also things like the sun degrading, the UV degrading our collagen and things like that. Like if you look at some, like a truck driver, for instance, there's a famous photo, I should have put it in here, but the left side versus the right side, because the sun is coming through the left. It is phenomenal how different the two sides look. So aside from the collagens, we also lose elastin. The elastin, I can remember being a little kid and doing this to my dad. I would take his knuckle and go like this, and I'd say, why does it stay up? And, because mine would just go back down, this little kid. That's elastin. So as we lose elastin, our skin doesn't snap back to the same place. We also
Unfortunately,
we also use hyaluronic acid. We have more of that in the skin when we're younger. And hyaluronic acid, it provides provides moisture and hydration. It draws 1,000 times its weight in water. So having hyaluronic acid in the skin is also beneficial for, just looking more youthful. Another thing that happens, bone resorption. Just like we lose bone in our bodies, it happens in our face. It's remarkable if you look at a skeleton of like a 20-something versus 60-something-year-old. There's a lot of bone loss that occurs. This area around the socket, the eye socket, it gets wider, and that contributes to those hollows that we see. Same with around the nose. This photo doesn't show it, but the aperture around the nose, it gets wider, and it contributes to that fold that we get, that nasolabial fold. The angle of the brow decreases, and we have a less sculpted jawline. So I like to think of it as like if you had a mattress with a perfectly fitting sheet over it, and then you swap that mattress out. So say you have a queen mattress with a queen sheet, and you go and you swap it out for a twin, the sheet is going to be folded and wrinkled, a little saggy, right? So kind of the same thing. You don't have that same scaffolding under the skin. And on top of it, the skin is losing structure, so the skin is saggier. So it's like this double whammy. Then we have fat atrophy. So irrespective of weight gain, weight loss, we lose fat pads in the face. They shrink, they get thinner, and they migrate. They usually go downward, and that again contributes to hollows under the eyes, or in some cases, fat pads under the eyes, like a bulge under the eyes. And the fat pads go downwards, and that contributes to like the jowling that we see. So lots of different things going on with our faces as we mature. The musculature. So as I alluded to before, we make these repeated movements when we live life, when we emote and eat, and all the ways that we use our faces. And this can lead to the lines around the eyes, the lines in between the brow, the forehead lines. We even get an orange peel chin, or as some people call it, chinulite, that dimpling of the chin. And there are things that can be done to help with that. Some muscles get weaker too, which can give a sagging appearance to the face. So why does this happen? Well, there's a lot of different things at play. Some of them we cannot control, like genetics and age. Some of the things we have some more control over, like UV, pollution, smoking, diet, hydration, stress, and sleep. Now, with that said, we can't go back and undo our past, right? I'm sure there's some people in here, like myself, when you were younger, you used baby oil. Am I right? You're not using sunscreen all the time. So, we can't undo that. But like Diana, what is it that you always tell people about? Like you have to.
There's you have to do some reversing, and then do whatever you can to try to slow it down, right? Like the clock isn't slowing down, right? Like Father Time, but you have to do whatever you can to slow it down. Like you said, baby oil. Like I did not grow up drinking water. The only water that I ever had was mixed in Kool-Aid. Like nobody put sunblock on, never mind reapplied sunblock. Right? So like that pigmentation that's rearing its ugly head now is like from a long time ago. And so I've had to do a lot of reversing, and now I'm doing whatever I can, taking whatever steps I can to just slow down the process, the aging process as best I can. Right? We can't stop it, but you can try to slow it down.
Yeah, most pigmentation. I didn't really talk as much about pigmentation, but you're right. Most pigmentation is caused by UV. Some of it is from hormones, and like we can get melasma during pregnancy from certain medications, but most of it is from UV. Yeah. And all we can really do is be good going forward and do a little bit of reversal with some of the tools that we have up our sleeve. So these are some of those things. So we have lots of different things like Sculptra, which I'm going to talk more about all of these. We have skincare products, like medical grade skincare products that we can use at home. We have energy-based devices and Botox and lasers and peels and all the things, and sun avoidance. So we'll do a little bit of a deeper dive into some of these things. So this patient, she came in and she wanted to look more lifted, more brighter. Didn't want to do injectables. Injectables aren't for everyone, and I always, I sit down and we do a very thorough consultation, and I try to determine why someone may not want to do it, and that's fine. We have other things that we can do. So in this case, she didn't want to do injectables, and so we decided to do a treatment called soft wave on her. Soft wave uses ultrasound to heat the tissue at 65 degrees Celsius, which is a temperature at which the collagen is denatured and new collagen and elastin is formed. So I think of it like weeding, like we're getting rid of we're weeding out, we're getting rid of the weeds, and we're fertilizing the soil for new growth of elastin and collagen. So, this is really good for lifting the skin here, like above the eyes. It's good for like the jowling. We do it on the neck. You can do it on the body as well, although I mostly focus on facial aesthetics. There's other things too, like there's radio frequency microneedling. That would be for someone that has deeper lines, acne scarring, like smoker's lines, deeply etched lines from sun damage. The radio frequency microneedling is really good for that. Basically, the needles go into the skin and then they emit a high heat that does a similar thing to the soft wave. It kind of like denatures that existing collagen and creates new elastin and collagen. So lasers and peels are another thing that we can do. This can help with pigmentation. This can help with lines, getting rid of sun damage. We have a laser at Element called the Ultra.
We're
raffling it off. Diana's had this treatment, I've had this treatment. It's a very low downtime type of treatment that creates little columns of heat in the skin. So if you notice a theme here, I keep talking about collagen generation. So all of these things, we're trying to induce a controlled injury to get those cells to produce new collagen. So in this photo, you can see her skin looks brighter. It looks more even. The tone and texture look more even. So creates those little columns of heat in the skin, thereby resurfacing. A little bit of redness after the treatment. Feel a little bit sandpapery for a few days, but it's really low downtime. Now, for people that have way more extensive damage, you could bring out the big guns and do CO2 or erbium. It's not something that I have, but there are lasers that do a very great job of resurfacing in a shorter time. The trade-off is more downtime, so you're very, very red.
And a lot more people, right?
Yes, correct. And then we also do chemical peels, which kind of do a similar type of thing. They're working though on the epidermal layer, the really top, like the top layer of the skin, to help just turn those cells over. Diana is a huge fan of peels. She's gotten really nice results on the chest, and
Well, I think, like, to your point, like the brightness, right? Just brighter skin in general. Like, yes, this obviously help with fine lines and wrinkles as well, but brighter skin is going to make you look more youthful, right? You don't have to go under the knife. Like, there's things that you can do just to look tighter and brighter, and it's going to make you look, more youthful.
Sculptra. This is a very popular treatment.
I just did that one too.
Yeah, we've done them all.
I have to.
Yes, she's everything that we're talking about, she's had. So Sculptra is a different animal. It's like a powder that we add water to, and we shake it up and we inject it under the skin. The molecule is called poly-L-lactic acid. It's a biodegradable, biocompatible molecule, and it just does a really nice job of very slowly building collagen. You don't see the results right away. It takes about 3 to 6 months. I call it the Benjamin Button treatment because it definitely takes some years off. And it just helps people look more lifted. This person, I mean, she's a model. She's very beautiful and she's young. But I do this on women of all ages. I mean, I wouldn't do it in someone, I don't do it on people really like younger than like their 30s, but my point is we do it 30s, 40s, 50s, 60s, 70s. So it gets a really nice result. It just replaces volume in areas that started sagging, and it makes the skin look just like tighter and more fuller. Yeah, exactly.
How long does it last?
It lasts for 2 years. What I tell people is that after the treatment, you do like what I call like a loading dose, and then there's a maintenance period. So the first dose is kind of a larger dose. Typically, we use a vial per decade that you are in age. So like if you're in your 50s, you do 5 vials. And you don't do that all in one session. It would be across 3 sessions. After that, I tell people once a year, get like 1 vial just so that the tank doesn't go to empty. If you wait for the 2 years, it's gonna be gone. So I tell people do 1 every, it could be every 6 months, every 12 months. It kind of depends on the person, their metabolism, their lifestyle factors, right? Are they good in the sun? Are they using good skincare at home? Because whatever you're doing in the office, you wanna make sure that you're protecting that investment and using good skincare at home. And, there's other factors, people who are, that work out a lot or that are very athletic or thin, sometimes they need to do it a little bit more often, maybe every 6 months, 1 vial, as opposed to every 12 months. But it's kind of a wait and see. And like post-menopause, we'll sometimes see that like, okay, maybe I need to do 2 vials this time, not 1, because the aging is just, it's accelerating.
So post-menopause and fast metabolism, I'm gonna be in there a lot.
I gotcha, you're working in the right place. Okay, filler. So filler is hyaluronic acid filler. It gets a bad rap, right? Because like I said before, you see a lot of bad filler, but you don't know when someone's had good filler because you don't, unless they tell you, you don't know that they've had it, right? So filler can be it's very natural looking when done properly. It restores lost volume, it can correct asymmetry, it adds hydration to the skin. Again, 1 syringe is only enough to fill a blueberry. So it's really kind of hard to make someone, in my opinion, look like a real housewife kind of face, or like, those are people that have just been getting it like repeatedly for years and years and no one's telling them no. I think filler lasts longer than what people realize. Like we used to say 1 year, that's not the case. You don't need to be doing it every year necessarily. It kind of depends on the person. So you need to have a provider that isn't afraid to tell you no, someone that you trust and someone who's aesthetic you like, because out of all the things that we do in aesthetic medicine, filler is the most artistic. It's definitely like, it's kind of like sculpting in a way. And so you really have to have a trust and a rapport with your provider. Okay, so this is...
And go to somebody that's been injecting for a really long time.
Got to.
Like truly, so just to give you a little personal story, I got filler for the first time probably like, I don't know, like a decade ago. Like my father had died suddenly and then I ended up going back to California and of course I looked like Tales of the Crypt. I'd been crying for 3 weeks, drinking copious amounts of wine, and I had nobody to stop me and I went and got filler. I don't know what I was thinking, and I was like, if I'm gonna get filler, I'm gonna go to a plastic surgeon. That's where I should go. And I go to a plastic surgeon, but what I've since learned is plastic surgeons don't inject, right? They cut. So some do.
Yeah, some do, but
this guy,
they're more in the OR.
They're more in the OR. So I'm thinking I'm doing the right thing by spending, an insane amount of money with this guy. And oh my gosh, it was so god awful. I had to go get it all dissolved. So it was a really expensive mistake. I'm just saying. So going to somebody who's been injecting for a really long time. So just do your homework, because it really is like it's an art.
Yeah, you want to go to someone who does it all day, every day, not just like on occasion. So,
Yeah.
So this is an example of a neuromodulators are Botox, Dysport. They relax the muscle so that you can't make expressions that etch the lines in. So like when we raise our eyebrows, we get the horizontal lines. When we furrow our brow, we get the 11s. When we smile, we get crow's feet, and so on. The chin. This patient has a very active muscle around the lips, and so we injected Botox in various places, her forehead, the 11 lines. So in both of these pictures, she's making like the angry face, but you can see it's much more pronounced in the first one. And she just purses her lips more. So when she doesn't have Botox, when she gets the Botox, it relaxes the muscles so that you don't see as many lines around the mouth. So that's just an example of what Botox can do. And although she's making a face in those photos, it also kind of like opens up the face. When you can't pull these muscles down and in, you get sort of like this opening of the face. And people generally feel better when they've had Botox here. There's a facial feedback loop. If you are making like an angry expression and you can't do it anymore, there's numerous studies on this showing that people feel better when they get it. Okay, so now we're going to talk about a patient who, this is Jen. This is a patient case where we're gonna go through all the things we just talked about because she's had all the treatments. So Jen is 50, she wants to look more refreshed, right? She's beautiful, she still wants to look like herself, but she just wants to look brighter, you know, rested. So, that photo's not showing up, but, let's see here. That's not good. That's not what I want. She doesn't look like that. That's so funny. That's so weird. It's always the second one. So, okay. I wonder if I can like put them in there. Yeah, sorry guys, bear with me for 1 second. Okay, well, there you go. Okay, so you can see, we actually treated her with, this is 10 syringes of filler, which sounds bonkers to people. I mean, it's a lot, right? But she had a lot of volume loss, like back here. We lose a lot right here. It's called the preauricular area. So she had lost a lot of volume there. So we restored the volume here. You can see like she was more squared off before, and we kind of just elongated her. We made the jawline a little bit more defined and brought her chin out a little more, and she just looks, I think, happier, brighter. You know, her face shape is more youthful. She has more of that inverted triangle. So that was 10 syringes of filler. That was in 2022. Okay, so then in 2023, she had an accident.
That's okay.
And what?
That's not terrible.
Let's see. We're gonna do better. Hang on a sec. She had an accident, and she had a scar above her eye, and the next slide I'll show you on her chin. So you can see that after getting the Genius, which is the radio frequency microneedling device, her scar got significantly better. I mean, virtually
You can't see it.
gone. Yeah. So, and it was a pretty bad scar. We waited like maybe 8 to 12 weeks before we did anything, kind of let it heal, and then we started doing some laser treatments. And this was probably after, I think, like 2 of the radio frequency microneedling devices and one or two with the Ultra, which is the one that we're raffling off, the resurfacing laser. I'm just gonna do the same thing on this next one since. Okay, this one, same thing. Same patient. She had also bumped her chin and significantly better, right? So she had a lot of stitches. I don't know how many stitches she had there, but it was like a very significant laceration. And then, okay, so then that was 2022. 2023, you know, we continue to age. These things aren't permanent. So she came in again, and some of the stuff that we had done had worn off a little bit, right? Some of the filler still looks good, but she wanted to just get a little refresh. So instead of having to do 10 syringes of filler this time, there was much less that we needed to do. So she comes regularly. She gets hydrofacials. She gets Botox every 4 months, and we did 2 vials of Sculptra. The one I was mentioning that's like a powder that we inject under the skin. That's the Benjamin Button one. So this is an example of you know, what she, after doing those treatments, her before and after. And then, sorry, don't know why this is being finicky. This is 2024, and I had them zoomed in, so sorry that they're not bigger. she has like less of that downturned nasolabial fold, or the marionette line rather. The nasolabial fold is less apparent. You know, just like that downward trajectory. We're getting it back up again, and that we did with continuing the hydrofacials, the Botox every 4 months, and then this time she had soft wave as well. So that is Jen, and then this is to show 2022 to 2024. Even though 2 years have passed, I think she looks probably 5 years younger. So, and this is all with non-invasive treatments. Like, I think we don't need, there's less of a need now for plastic surgery. It depends on what your goals are, but I just think that there are ways now that we can mitigate these changes that happen to our faces with in-office treatments that have very minimal downtime and minimal pain, and we've got lots of stuff at our fingertips now. I mean, it's a fun industry to work in because there's always new changes. I mean, I don't know if any of you have heard the new buzzword. South Korea always has like all the new stuff, right? They are injecting salmon sperm. Salmon sperm. Not yet, but salmon sperm and exosomes. That's always, that's a hot buzzword these days. So yeah, lots of crazy stuff. I don't know if that's going to make it to the U.S. or not. We'll see. But anyway, that's kind of where we're at. So yeah, I mean, back to just to like bring it full circle. These things are all nice to have. They're elective. You don't need to have them. But if it's something that makes you feel better, there are some tools and tricks that can be done to help with this process. So now I will